Hey, hi, apa khabar semua? Welcome back to the latest episode of Borak Sempoi with Dr. Kiru. So, we are back again with another new episode, and I've been listening to what everybody has been asking on my forums, and a lot of questions were asking regarding cancer. So, pertanyaan dia like, apa tu cancer, doktor? Why is it so bad? Kalau saya dapat cancer, apa rawatan dia dan sebagainya. So, as you all know, I'm a breast surgeon. I deal with a lot with breast cancer and thyroid cancers as well. Tetapi, I thought it's best we get the real expert on cancer topics to be with us today in this show. So I have a very, very special guest and a very good friend who is none other than Dato Dr. Amir to join us today in this podcast. Welcome, Dato. How are you?
Thank you very much, Dr. Kiru. He is a brother to me and we have gone through a long journey together. Thank you, and I'm honored to be here today.
Yeah, we're so honored to have you here with us as well. Dato, maybe you can share with us a bit about your background.
Right. Well, I'm a Malaysian. I'm a Penang boy, and I grew up in Penang. I did my education here, and then I flew to the UK. I studied in the UK to do my undergraduate and postgraduate degrees. Came back, and I've been serving the community for the last 20 years.
Yeah, awesome. Good.
So I'm currently attached to Icon Oncology Malaysia, which is based in Island Hospital, Penang. So I've been here for 2 years now.
Okay.
But my experience in cancer has been for the past 20 years.
Yes.
So I've been moving around different hospitals. Prior to this, I was in Gleneagles, Penang, where we met and we worked together for the last 10 years.
Betul. I mean, I got to ask you this lah. When we talk about cancer, I think you know, people say, oh, dah dapat cancer, the first thing is that look that, I'm so sorry to hear this and all that. And most of cancer treatment is very depressing, very painful. But you have been dealing with this for more than 20 years. Okay. So, can you tell us a little bit, what is the expectation of the treatment for cancer, and what is your personal, in your journey, how do you manage to always have the strength to share with your patients that yes, we can do it together?
Actually, it goes back to the history of why I became a doctor.
Good.
I wanted to be an aeronautical engineer.
Ooh.
And I almost got a scholarship for that. And then at the age of 16, my late father sat me down and he told me, why don't I consider being a doctor?
Wow.
Because in that way, I can reach out to more people. There's a shortage of doctors, not in Malaysia, but throughout the world.
Okay.
And it's a noble profession. And by helping people who are sick and who are dying and curing them, allowing them to live a longer life with an improved quality of life, the satisfaction is not in any other specialty or profession. So I think being a doctor itself, I'm blessed that God opened up our ways, but there was a junction in my journey where I almost became an engineer, aeronautical engineer. So from that point onwards, it was my aim to do what I can for the people around me, because in my family as well, there were members of my family, close family members who died of cancer, heart diseases, and even my late parents, both of them passed away from cancer.
Oh, really sorry.
For which I had an opportunity to treat them.
Yeah.
So I think this is important for me personally. But at the same time, looking at the community today, we know cancer is the biggest killer out there.
Yeah.
And it's getting more and more prevalent.
Yeah.
So what can we do? We build more centers, human capital, education, specialization in oncology, and now we have subspecialization. For example, Dr. Kiru, he's a subspecialization of surgery, breast, endocrine. So this is what we want. In the past, it was all general surgery, and you've gone through that journey, so you have focused and you're good at it. So I think that's the aim, basically.
Yeah, see, that's excellent, lah. That means now we understand where the motivation comes on, because you're emotionally charged and you're very related into the field that you're working as oncology specialist. But throughout the years, I'm sure you would have seen the evolution of oncology in terms of the treatment options, in terms of the medication and so on. So do you think right now in Malaysia or in Penang, we have world-class standards of oncology treatment for our patients generally?
I think if you look at the last 20 years, when I first started working, we only had a handful of drugs, only chemotherapy drugs, only a handful for all the cancers available. And now, within 20 years, there are more than 1,000 drugs that we need to choose from. And not only chemotherapy, we have so many different types of immunotherapies, targeted therapies, whether it comes in tablet form or injection or IV. So in the last 20 years, so much has been developed. Technology has advanced so much, not only in drugs, but also in machine. We've got PET scans, CT scans, MRIs, bone scan, radiation. All this has also improved significantly, improving survival.
Correct.
I can just imagine what's going to happen in the next 20 years, where patients were not surviving beyond 6 months 20 years ago. We see patients going beyond 5 years now.
Yeah, that's true.
So it's becoming a chronic disease.
Yes.
And with the help of the Ministry of Health of Malaysia as well, we are able to bring in drugs at an early stage.
Oh, that's fantastic.
So the moment the drug has gone through clinical trials, approved in the US or Europe, we are able to bring it quite soon into Malaysia. We don't have to wait years. Some countries, they have to wait 5 years.
Right.
Because of the system. So I think that bureaucracy has been reduced in this country.
Fantastic.
So I think that's also an important factor.
Okay, fantastic. I mean, keeping that, maybe we'll talk more about the drugs later after this, but I think I want our viewers to understand. Can you tell them in very simple terms, what is cancer? Because people, when they hear cancer itself, they don't want to talk about it. They feel like, mesti nak mati ni, cannot lah. So maybe something very simple. What is cancer?
All right. So cancer is actually a mutation that happens within your own normal cells. Over a period of time, for example, as you age older, your cells undergo a lot of damage, whether it's through environmental exposure, whether it's through food intake, or chemical exposure like cigarette smoking, alcohol, and so on. So over time, your normal cells develop a mutation within your genetic system, your DNA. And that mutation is a signal for the cells to keep growing. So you do not get cancer from your relatives by touching them, or your siblings by just being with them, sharing the food, or sharing clothes. Not to worry. It's not spread by touch.
Yes.
It is within you. We are all exposed to cancer every day actually. So the moment the cell undergoes a mutation, your immune system recognizes that mutation and it kills off that bad cell. However, when patients get older, their immune system gets weaker.
Yes.
So then the immune system does not recognize that normal cell as a cancer cell. It assumes that it's just part of the body.
The body, yes, correct.
So this cancer cell become into 2 cells. From 2 becomes 4, 8, 16, 32. Eventually it gets into millions. And for your information, 1 centimeter of cancer is about 1 million cells. So you do not get cancer overnight.
Yes.
It happens 2 years earlier. So by the time you can detect cancer today, 1 to 2 centimeters, it already started 2 years ago from 1 cell, and it takes time to reach 1 million.
Correct.
But once it's 1 centimeter, which is still stage 1, curable, have surgery early, but it won't be long before it goes into stage 4. Because from 1 million, it will become 2 million, 4 million, 8 million.
Correct.
Within 6 months, patients can go into stage 4. And this is where the problem lies in our society.
Correct.
Our patients, they fear going for medical checkup.
Correct.
They fear having all kind of tests because they don't want to hear the results. Some go into denial. They don't want to have standard treatment because unfortunately, a lot of our people believe in alternative products, herbal, traditional, which is not meant to replace proven medication. So I think that is an important factor. So cancer is within us. However, the incidence rate, that means there are more and more people being diagnosed now because of the way we live our life, which is what we're going to discuss later on as well.
Yeah. Actually, I mean, when you think about the people who are getting diagnosed with cancers, so we know in female, of course, because I deal with breast cancer. So the number one leading cancer in women is breast cancer. For men, I think it's colorectal cancer now still.
It used to be lung cancer
Lung cancer. Okay.
due to smoking.
Right.
However, now colorectal cancer has overtaken lung
Yeah.
because smoking also causes colorectal cancer.
Okay.
And not only that, it's our dietary intake. So our food intake also determines
Okay.
the risk of colorectal cancer.
Cancers lah. But overall, I mean, in the last 20 years, we are talking about time. Do you see, I mean, definitely you're seeing an increase in the number of cancer cases among your patients as well. More patients are getting with cancer, right?
Yes.
So do you think it is something to do, of course, with the environment or with the diet specifically? Or is it the way we live? Can we do something about it?
Yeah. So, patients believe that, okay, if you are a vegetarian for your whole life, you will not get cancer.
Yes, that's a
Right?
belief, yeah.
I do have vegetarian patients who have cancer. Some people believe by being religious, you will not get cancer. I have monks, priests, and imams who have cancer.
Yeah.
And some people who have never smoked in their life get cancer.
Oh, yes. Correct.
So in the past, we used to think that every smoker will get cancer. But we do see people who are in their 80s, smoked their whole life, and they're still healthy.
Yeah, that's true.
And some people at the age of 30 lived a good life and they developed cancer. So I think it's multifactorial.
Okay.
So one is the risk within your family.
Okay.
So if you do have close family members with cancer, history of cancer, whether it's your parents or your grandparents, the genes can be passed down.
Right.
So that itself increases your risk of cancer.
Right.
And then comes exposure to your environment. For example, astronauts, pilots, those who travel frequently in the air are exposed to cosmic radiation.
Yes.
And we know cosmic radiation, that means there's a lot of types of radioactive particles in space.
Correct.
Gamma rays, electrons, X-rays and all that. So these people are more exposed to radiation.
Yeah.
Just like sunlight, UV radiation can
Correct.
cause skin cancer.
Skin cancers, yeah.
If you go to Australia, skin cancer is number one.
Yeah.
Not breast, not colorectal.
Yeah. Because of their
Because of
UV.
UV radiation. So I think we are not so at high risk of skin, but we are of internal organs because of our food. And then of course comes the other factors like excessive intake of sugar, fatty foods, processed foods. So if we look at our general diet today, each and every one of you just sit back and look at what you've been eating for the last 20 years. Ask your grandparents, how much of processed food were they eating when they were young?
I think nothing.
They never had any fast food chains,
Very true.
for example. But I'm not blaming any fast food here. However, everything has to be in moderation.
Correct.
So if you are heavily reliant and dependent on fast food, processed food, you increase your risk of not only colorectal, but every cancer.
Yeah.
Whether it's mouth, tongue, throat, esophagus, stomach, colorectal. So I think that's also something we need to visit and rethink. And then of course, exposure to chemicals. Smoking, tobacco,
carcinogens,
alcohol,
Yeah.
right? Even vape.
Yes, there's a new
Vape
trend.
also, although we don't see direct links because vape is something very new, but we know these are also chemicals that damage normal cells.
Okay. Actually, I mean, I think many of our viewers are aware that I'm a pediatric surgeon, so I deal a lot with obesity and lifestyle medicine in general. Obesity is now the new, I would say, killer lah. But it doesn't kill you immediately. It's like a chronic disease as well.
Yep.
You develop obesity over time. But is being obese another risk factor for cancer?
Okay, I think being obese itself also increases your risks of diabetes, heart diseases, and cholesterol. And generally, obese people are less active. They do less exercise. Exercise itself is an important factor in reducing your risk. There have been lifestyle studies in the US and Europe which have shown that modifying your diet, reducing fatty intake, as well as increasing exercise and activity can help relatively reduce your risk of diseases, including cancer.
Okay.
But the problem with obesity is it takes time for the cancer to develop.
Correct.
I'm more worried that the obese people may go off earlier due to heart disease.
Okay.
So we may not see obese people getting cancer so soon,
Yes.
but they pass away due to heart attacks.
Heart attacks, correct. Okay.
So which is also a number one killer in Malaysia.
Okay. And I mean, there's a myth going on also, among our patients. Because as you know, when they're diagnosed with breast cancer, they come and see us. I refer them for chemotherapy, radiotherapy. And the next question definitely they'll ask you, Doctor, adakah anak saya akan dapat cancer juga?
Yeah.
Because they feel that they are with a sentence for them and they're worried about the offspring and so on. Maybe you can tell us a little bit about genetics and family history.
That's right. So if there is a patient that's developed cancer at a later age in life, when you are 80, 90, the risk of it being a genetic problem is very small.
Correct. Yes.
Right? However, if your parent developed cancer at the age of 40, that means there's some genetic problems going on within the body.
Correct.
And these genes can be passed down to the children. It doesn't guarantee that you will get cancer, but you can increase your cancer risk by 25%.
Yes.
So you know it's not 100%, but the risk is higher.
Correct.
So for these people, I would advise do what you can to reduce your risk.
Okay.
Genetics is something you cannot change. You are born with that. But the other things you can change.
Right.
Being active in life, sleep well, drink plenty of water, cut down sugar,
Yes.
exercise regularly, do not have stress. You see, stress itself weakens your immune system. When we go through exams, we are studying for exams, we go through a lot of stress.
Very true.
And we realize that we get cold sores around the lips sometimes. Why does that happen? Because your immune system is weak, so the viruses that live on your skin take advantage.
Yes.
So when you are under stress, your immune system goes down. And we're not talking about stress 1 day, 2 days. It's years of stress. So I think enjoy life. Important thing is life is short. It's unpredictable. When we say that you might be able to live, average life of a person today is about 70 years of age. What does that mean? It means that half of us humans will be dead by 70.
That's true.
That is what it means by average 70 years of life. Don't think that, if a man can live at the age of 70 means I can live beyond 70. It means that half of people are already dead before 70.
Correct. That's true.
So it's something to think and ponder. Be blessed and happy with what you have.
I think everybody's put the benchmark now at Tun, who's living until 100.
So he is that exceptional.
The outlier. Okay, I mean, speaking about family history of cancer and so on, let's talk about detecting cancer. Okay, we always talk about early detection saves life. We have campaigns. We go around, speaking at conferences and in meetings, and we also speak to public. So public awareness, I still feel, is lacking. So can you tell us a little bit what is screening to diagnose cancer? Because people think that, I want to go for screening, but they don't understand what screening is.
Right. So screening is actually a test that is done whether through the blood, using an X-ray machine or an ultrasound machine to detect the smallest possible lesion.
Yes.
Right? So for example, if you do a mammogram, you might be able to detect 1 to 2 millimeters of cancer. It's possible. Because 1 millimeter of cancer is not easily felt. Even a centimeter is difficult to feel.
Correct,
So if we rely on women just to examine yourselves, most of them will not pick up early cancers.
Not enough.
So that's why in the UK, majority of women who are diagnosed with breast cancer are stage 1.
Yes, very early.
Because of screening.
Correct.
So they routinely go through screening every 3 years, especially after the age of 45. If we go to Japan, stomach cancer is number 1 killer.
Yes.
And in Japan, it's compulsory for them to undergo scope.
Endoscopy,
So every 3 years to detect early cancer.
Correct.
So I think for us, by the age of 40 to 45, we should start doing regular medical checkups,
Right.
which is a combination of tests.
Right.
Because you just don't want to focus on one organ.
Correct, yes.
We've got so many internal organs.
Correct.
So by doing a chest x-ray, at least you see your heart and lungs.
Yeah.
Ultrasound of the breast,
Yeah.
of the tummy.
Yeah.
Because in the tummy, you have so many organs.
Correct.
Liver, kidney, spleen,
Pancreas.
your lymph nodes, pancreas,
Yeah.
and then of course the gynae organs.
Correct.
And for men, prostate.
Yes, important. Yeah.
And then blood tests.
Yes.
So some of these cancer cells can be detected through blood tests.
Correct.
But nothing is 100%.
Yeah.
That is why we routinely say do it every 1 to 3 years.
Correct.
You do a test today doesn't mean that you are free of cancer.
Yes,
Some people
correct.
think that, oh, I've already done the test.
Yeah, I've already
I'm
done
free of
already.
cancer.
Correct.
It may be that your cancer is so small,
Yeah.
like what I explained.
Yeah.
A centimeter is 1 million. 1 millimeter is 100,000 cells.
Yeah.
So if you've got 10,000 cells,
Yeah.
cannot be detected by any cell, any kind of test.
Yeah.
So you routinely check. So a year later, it might be 5 millimeter.
Yeah.
It's still stage 1.
Correct. So that's why I think it's very important. You hit the nail on the head. Get yourself screened routinely. That means most of the screening programs is like 1 year or 2 years. So if you have the means and make the means to get yourself checked up. And once you've done screening and let's say we stick to breast so you get a breast lump and then most of us will advise our patients, okay, ma'am, please go and get a biopsy so that we know whether it's malignant or not. Now the question is, a lot of people will ask us and say, doktor, kalau saya tembus and dapat biopsi, dia akan melimpah keluar dan merebak, or by doing biopsi it's haram and all that. So from both the perspective of a scientific expert as well as a religious context of it, maybe you can elucidate to our viewers importance of biopsy.
80 to 90% of breast lumps are usually benign.
Okay.
So about 10% to 20% are cancerous.
Right.
So if we see 10 women who come to our clinic with a breast lump, 8 of them might be just benign. I mean, it could be a cyst, it could be just fatty tissue and so on.
Correct.
But how do we know who has cancer and who doesn't have cancer?
Correct.
The only gold standard test is biopsy.
Correct.
No scan can 100% confirm cancer.
Right.
Biopsy only means taking a sample using a fine needle to look under the microscope whether these are truly cancerous cells so that we can do the right treatment.
Correct.
There is a belief among Malaysians and in Southeast Asia that biopsy will cause the cancer to be more aggressive and spread.
Correct.
This is actually a cultural belief.
Yes.
There's another belief that says that eating meat can cause cancer.
Yeah.
That's also a wrong myth.
Correct.
Drinking milk can cause cancer.
Oh man.
So I think, a lot of people, as we say, when you hear something, you need to verify, is it true or not?
Yeah.
You would not just jump into conclusion,
Yeah.
based on rumors. So rest assured, if truly biopsy was dangerous,
Right.
the Americans and the Europeans will never do it.
Correct. Exactly.
Because our Malaysian public are very religious people.
Correct.
They believe in God as what is mentioned in the constitution of the country.
Correct.
Right? Believe in God.
Right.
We all have our own beliefs,
Beliefs,
but we
correct.
believe in God.
Yes.
And a lot of Malaysians do not really fear death because of our religious beliefs.
Yes. Correct.
So a lot of patients say, it's okay, I rather die. They are prepared for death.
That's true.
But the Westerners are not prepared for death. So if truly your biopsy was dangerous, the Americans and the Europeans will never do it
Yeah.
because they fear death more than us.
That's hilarious lah.
So
Yeah.
do not believe in that kind of myth.
Yeah. Hey, well said, man. I think that's true. Now, when we talk about, okay, once you have screened, once you have biopsy, then you are bound to have a diagnosis whether you have cancer or not. And that's where we come in as surgeons to operate and to remove the organ that is involved. So if you have colon cancer, so we resect the colon and join it back. And after patient recovers, or even doing a mastectomy for a breast cancer, or even now we are going towards breast conserving surgery. So we try not to remove the whole breast. But once you finish, then the main player after that is the oncologist, because that's when they will use the information from the surgical outcome, from the results, and they will plan further treatment. So, Amir, the word chemotherapy, you know, when I say, okay, you're going to see Dr. Amir for chemotherapy, it frightens a lot of people. Okay, they'll say that, oh, my rambut will gugur, or I will have very bad shivering and fever and stuff like that. So, please tell us nowadays, with this current age, the advancement of chemotherapy is so great. Do they need to be afraid of chemo?
Okay, so I think when we treat cancers, we need to look at treatment and prevention of cancer.
Yes.
Especially when we look at stage 1, 2 and 3.
Correct.
So that's where the role of surgery is upfront. Without surgery, there is no cure for breast cancer.
Yep.
That is definite.
Okay.
And we normally enforce and reinforce that to our patients who come to us for second opinions, who try to escape surgery because of the myth that if you do it, you cut it, it will spread.
Yeah.
Now, after surgery, I give you an example of what the situation is like. You have grass in your house.
Yep.
Within the grass, you have weeds.
Correct.
Now, surgery is like pulling out the weed, including the roots.
Okay.
However, there might still be some roots left behind in the soil.
Yeah, that's for sure. Yeah.
So you have removed what you can see.
Correct.
But the microscopic cells which you can't see, that's where chemotherapy and radiation comes in.
Correct.
Or you can say chemo is like you spray the weed spray on your grass.
Roundup.
Roundup, so that you kill the bad weed that can grow back. Okay. So that's the purpose of treatment. And majority of chemotherapy drugs today do not cause hair loss anymore.
Wow, that's
20 years ago, yes, most of the drugs, they cause alopecia, which means hair loss. But today we are fortunate, as I mentioned earlier, we have more than 1,000 drugs in our hand. And these drugs, majority are from plant-based.
Oh, wow.
You see, our patients believe in traditional herbal treatments.
Correct, yeah.
Chemotherapy is majority plant-based.
Plant-based, huh?
Leaves, trunk, and roots of plants where the drug is extracted.
Okay.
Just like, for example, ginseng.
Yeah.
Ginseng and ginkgo biloba.
Yeah.
These are plant-based,
herbal.
traditional herbal.
Right.
But you cannot just take a ginseng, cut it and eat it that way. You need to purify it, get the right dose, and then it works accordingly.
Right.
And we have capsules now, ginseng and ginkgo.
Okay.
Same principle for chemo.
Wow.
We extract. This process costs a lot of money.
Yeah.
That is why the drugs are expensive.
Yeah.
We don't do it in Malaysia. It's all done overseas, whether in Japan or in the Western world. We unfortunately have to rely on that because we do not have that funding.
Okay.
To produce our own chemo.
Okay, excellent, Amir. So now we have other adjuvant therapies like radiotherapy, and then you have immunotherapy, hormonal therapy. So patients are sometimes confused, don't tell me the doctors are trying to make money by putting me on so many of these treatments. So let's dispel that myth. Cancer treatment is not only surgery, it's not only chemotherapy. What do you think?
So cancer is just like bacteria. So if you look at bacteria, there are thousands of different types of bacteria. And the bacteria that lives in your colon is different from the ones that live on your skin. So if you've got a skin infection, you need a different antibiotic to diarrhea. If you've got a urine infection, it's different to a sore throat. How do we know this? Through research. R&D is very important. The antibiotics were first discovered 100 years ago during World War I.
Correct.
Only one drug, penicillin. But look at what we have today.
Exactly.
We've got hundreds of different antibiotics for different purposes.
Correct.
Because bacteria has also evolved.
Correct.
Cancer also evolves. A nose cancer behaves differently to a bone cancer.
Very true.
So we need to direct therapy according to the cancers.
Correct.
So some cancers only rely radiation for cure. For example, nose cancers.
Nasal, correct.
Or cervix cancers. But cancer of the ovary, we cannot radiate. It doesn't work. Although they are of the gynae origin.
Right.
Cervix, yes. Ovary, you can't. you need surgery.
Surgery. Yeah.
Lymphoma, you don't need you don't need radiation, you don't need surgery.
You don't need surgery, yes.
Only chemotherapy,
Yeah.
for example. So how do we know that? We take cells, we grow them in cultures, we test drugs, and then of course we also test mice.
Yeah.
That's how the initial process of research, just like how you produce your cosmetics. It's all tested in labs, in animals, and then human trials.
Right.
Finally, it's sold.
Right.
So the drugs that we use today, the new drugs, were actually discovered more than 10 years ago. But because of the research process, it took a long time to prove that this drug actually works.
Excellent.
So radiation is an X-ray treatment which mops up any cells. It clears up microscopic, and different cancers have different purpose of radiation.
Right.
Some are palliative and some are curative.
Yes.
Radiation can be one-off session or it can go up to 35 sessions.
Yeah.
It's mind-blowing.
Yeah.
We have no time to explain every cancer's radiation protocol.
You won't. Yeah.
But we have the technology where we can focus on the cancer itself,
Wow. Amazing.
sparing the normal structures.
Right.
So the machines have different names, but the principle is similar.
Right.
Just like you have a smartphone, you've got Apple, you've got Samsung, you've got all kind of brands. It's a smartphone.
Right.
So radiation is the same.
Right.
Different hospitals have different machines.
Correct.
But the target is delineated. We see the target,
Yeah.
and the machine delivers the treatment
Okay.
to burn off the cancer
Right.
in places where surgery cannot reach.
Right. No, that's important. Yeah.
Deep in the brain, for example,
Right.
brain stem, tumors behind the eye. Now, we don't want to burn the eye.
Correct.
When we treat brain cancers, we want the patient to survive.
Correct.
We don't want the patient to be blind, deaf,
Yes.
who's gone through stroke,
Yeah,
can't do anything, but they're alive.
They're like
As a
not
vegetable.
worthy. Yeah.
We don't want that.
Don't want that.
So we want good quality of life. So the machines, fortunately today, allow us to do that.
Right.
Immunotherapy means, just like its name implies,
Yeah.
it stimulates your own immune system to detect cancer.
Right.
Cancer cells are very smart.
Right.
They are like spy planes, cannot be detected by radar.
Right.
So your immune system has a radar,
Right.
but the cancer cells are not seen.
Right.
That's why they keep surviving.
Okay. No wonder lah.
So when we inject drugs, these drugs contain certain molecules on it. They will sit on the cancer cells.
Yeah.
Because we normally do tests, genetic tests.
Correct.
Example is a PDL1 test, for example.
Example.
So we know that the cancer cells have got this receptor. We inject this drug, it sits on the receptor.
Yep.
Now the immune system can detect, this is a bad cell.
Yeah.
Prior to that, they never knew.
Yeah. Correct.
So your immune system will attack the cancer.
Right.
So we don't kill anything. Those days, chemotherapy was like a bomb.
Correct.
You inject, everything dies.
goes. Yeah.
Now it's so targeted and refined that the side effects are minimal,
Yeah.
and stage 4 cancers can go beyond 5 years.
Actually,
Which
that's
was unheard of before.
Amazing. Yeah. So, I mean, it's fair to say that, of course, we see a lot of international patients. So the care in Malaysia, the standard of oncology practice has come to world standard class, would you say?
I would say that. And I think we have got international recognition as well.
Yeah.
So a lot of healthcare bodies have actually certified and accredited Malaysia.
Yeah.
So we've got JCI accreditation, ISO accreditation. You know, Malaysia is now the favorite medical tourism destination
Right.
worldwide.
That's great. Lah.
We have patients coming from the US, from Japan, and the Middle East. But of course, majority of our medical tourism comes from our neighboring countries,
Yeah.
especially Indonesia.
Indonesia. Yeah.
And we are actually quite fortunate that we are able to help our Indonesian patients.
Yeah.
Because we are all one community.
Exactly.
And by doing that, we are also sharing our knowledge with our Indonesian counterparts.
Yes, that's good.
So
Teaching.
we teach. So patients come over. When they go back to Indonesia, we also communicate with the doctors in Indonesia. So we are not selfish to say, no, we only want the patients.
Yeah.
We are sharing and departing information
That's
and
great.
knowledge.
Okay. So not only the patients and not only our counterparts overseas as well, patients when they come, they go through emotional trauma, not only them, their families as well. So I mean, in your experience, how do you engage the family, keep them motivated, especially the spouse, a wife is affected with breast cancer, and then the husband looks to you for treatment and so on, and then they are the shoulder to cry on when they go back and all. So how do you, get the family involved in the treatment option as well?
Yeah. So I normally discuss all treatments in the presence of the family members.
Yeah.
Usually. Sometimes patients only come alone.
Yeah.
When they travel alone, then it's a bit more difficult.
Yeah.
But when they come with their family members, with their spouse or with their children and siblings, because we see a lot of elderly patients who come with their children, and they are the decision makers.
Yeah.
There are times that we have to be honest with patients
Yeah, I think that's important.
and the family,
Yeah.
right? We do not want to give false hope.
Correct.
We are doctors, but we are also humans. We recognize our limitations.
Correct.
When there comes a time, as my professors in the UK used to say, no treatment is a treatment option.
Yeah.
It doesn't mean that you need to keep giving treatment until the patient passes on.
Yeah. Yeah.
There comes a time when we realize that enough is enough. There's not much we can do.
Yeah.
Whatever time that they have, spend it with their family.
Yeah. That live with dignity.
Live with dignity.
Yeah. Yeah.
All we need to do is reduce pain, reduce suffering. Right? So I think this is important to get the family involved, because sometimes families have expectations which are unrealistic.
I think so, yes.
Some of my family members of the patients will come and say, look, I need my wife to remain alive for the next 3 years because my children are growing up.
Yeah. Oh, I see.
Or someone will say, I want to attend my child's graduation in a year's time. But I know most likely they may not survive that long. So we just need to tell them the truth so that they are prepared.
Correct.
They may not be happy to hear, but over time, it will sink in and they will accept.
Okay.
Cancer patients undergo a phase of mental trauma. Depression is 80% common among cancer patients. It's very common.
Very common.
It can be mild to severe.
Yeah.
We've also had patients who have committed suicide.
Oh my God. Yeah, yeah.
So it's very difficult as a doctor. We only can spend a certain amount of time at home, in the clinic with them.
Yeah.
At home, the environment is the most important.
Yeah.
If a patient is all alone, they are more prone and susceptible to harming themselves.
Harming themselves, correct.
Whereas if they've got family members who are always with them, supporting them, taking them out, they are more motivated.
Yeah.
And more motivated to continue treatment.
Yeah, yeah.
That's another important thing.
That's very important. See, I mean, from what you hear, from what Dr. Amir has said, you know that he's an oncologist who has compassion and who has a lot of professionalism in the way that he interacts with his patients. So, Amir, I got to ask you a personal question. Does any patient in your mind, or the story of what patient that you manage, where you can share, maybe you don't have to tell us who is it, but maybe share the experience and the challenge that you had in managing them, maybe in your experience?
Yeah, I think I will just share a difficult case.
Okay, yes.
So this particular patient was treated elsewhere.
Okay.
And the truth was not told. They were advanced cancer.
Oh man.
So when they came over to me, they had very high unrealistic expectations of cure.
Oh, okay.
Despite us telling them repeatedly that the aim of treatment is to prolong life. However, they kept insisting that I must cure them.
Oh, wow.
And there came a time, after about a few months, I decided to stop treatment.
Yeah.
And I told the family members, take your mom home. Nobody else can do anything.
Yeah.
However, we leave it in God's hands.
Yeah.
They were not willing to do that.
Right.
And they saw a second opinion. And when they had that second opinion, of course, I can understand my fellow colleagues.
Yeah.
They don't want to also disappoint patients.
Yeah.
Treatment was given and the patient died immediately.
Ayo. Yeah.
So if the patient did not have treatment, she would have probably survived a few weeks longer.
Correct. Yeah.
With the family.
Yeah.
Whereas with the treatment, the patient died and the family went berserk.
Yeah.
So of course now the blame shifted to the new doctor.
Oh man.
So I escaped.
Yeah.
But it's not nice.
Yeah, correct.
I feel sorry for my colleagues as well.
Yes, it's
and when patients come to me for second opinion or third opinion and all that, we never judge and criticize other fellow doctors.
That's true.
Because sometimes patients do not tell the truth.
Yeah,
We find that very commonly.
that's yeah.
I normally verify with my colleagues.
Yeah,
This patient came to you, what did you say?
Yeah.
And the story is totally different to what the patient said.
exactly. Yes.
For example, the patient will tell me, the doctor did not tell me my diagnosis,
Yeah,
did not tell me about my stage. And I'm a bit confused.
yeah.
It's not possible for an oncologist not to discuss that.
Correct.
And when I check with my colleague, and it's
Yes.
all documented,
Yeah,
it's just that the patient did not want to disclose.
disclose. Correct. Yes.
So these are the challenges we face.
Yeah.
We try to do the best we can, but sometimes we also get disappointed that we have not done enough for them.
Yeah. Yeah.
But we take it with a pinch of salt. This is a learning curve for us.
Yeah. Yeah.
So, as we get these experiences,
Yeah.
we grow wisdom.
Very true.
And just be patient.
Yeah, yeah. Exactly. That's why I think this story really highlighted your professionalism and your compassion in managing these patients as well. Okay, I think we had a super productive discussion today in our Borak Sempoi episode. I think I would like to end on a very strong note. I would like to ask you, Amir, what is the one message that you want to send to every Malaysian who's watching here, or Indonesians as well? What do you want them to remember about cancer? What would that be?
Cancer is getting more and more common today, right? Let's not hide behind walls thinking that it will never affect us. It's just like war. We may be comfortable today, but we don't know in the next few years what happens,
Oh, yeah.
right? So your body is your responsibility.
Yep.
If you do not look after it properly, you have no one else to blame except you.
Yeah.
However, if you've been looking after yourself well and you still develop an illness like cancer, there is hope.
Yes.
Even in stage 4 disease, there is hope. Do not lose hope. There have been trials in the UK which compared two groups of patients, those who were negative and those who were positive. And they found that those who were positive thinking, that could fight and had the willpower, outlived the other group.
Yes.
So your mental health is also important. So I think get tested, reduce your risk of cancer or any other illnesses by living healthily, which you will learn more and more by joining this series of podcasts with Dr. Kiru.
Right. Thank you.
So I think that's the only message I have. So the final message is keep following Dr. Kiru.
Yeah. We'll have more insights into medical conditions, health information, and so on from experts like Amir. And Amir, thank you so much for being my guest today. Really appreciate that as well. Before we leave, do you have any parting words for everybody out there?
Yeah. I'm happy to be here. Once again, the honor is mine.
Thank
that
you.
You've invited me and you thought of me. And I'm happy to share whatever knowledge that we have discussed today. And think about it, ponder about your existence, how you've come into being here in this world today, right? Because in our body, we have trillions of cells, which are all working synchronously. As I'm talking, trillions of cells in my brains are working together.
Yeah.
It's beyond our understanding. So
Amazing.
cancer also is something that scientists cannot understand. We keep producing new drugs thinking that we've found the key, yet it overdue. The cancer cells are outsmarting us.
Yeah.
So they produce new pathways to survive. So I think it's something that we have to look back and say, whatever it is, sometimes it's just luck.
Yeah. Yeah.
I tell my patients it's luck. And for your information, this session today, I have come on my own time.
Yeah.
I'm not paid anything except pisang goreng.
And teh tarik.
Yeah! Penang style.
Thank you, Amir. Thank you, and see you at our next podcast of Borak Sempoi next round. Cheers. Take care, everybody. Bye-bye.